Good morning and welcome to Candid Conversations. I am Kelly Fenner, the Chief Diversity and Inclusion Officer with the Baltimore County Police Department. The focus of today's conversation will be in recognition of Mental Health Awareness Month. We will be discussing mental health and wellness with some professionals in the field. As I introduce the panelists, can you please give a brief bio and actually explain why you agreed to be a part of today's conversation? I'll start with Kerry.
Absolutely. Thank you so much for having me today. I'm Kerry Graves. I am the Executive Director for the National Alliance on Mental Illness Metropolitan Baltimore affiliate, and we are the nation's largest grassroots mental health organization providing education, support, and advocacy services for individuals living with a mental health condition and their family members. Sorry, Kelly, are you receiving feedback on your end from me? Because I am.
I'm not. Is anyone receiving feedback?
You are.
Anybody else?
Let's see if I can change
I'm
it
not
and
getting
take off. I'm going to change it.
Headphones. Is that better for everyone? Okay, let's try that then. So we provide education, support, and advocacy for both individuals living with a mental health condition as well as for their family members. And we do that through peer programming. So our volunteers in the community all either live with a mental health condition or are caregivers for individuals with a mental health condition, and they share their lived experience to help others along their mental health journey. All of our programs are operated virtually right now and are all free. So I encourage the community to check out our programs at namibaltimore.org for more information. And then we also provide crisis intervention training to the Baltimore County and Baltimore City Police Departments. Again, ensuring that when individuals are calling 911 to receive in a mental health crisis, that they receive help. And that they are directed to appropriate treatment services. So our services, again, are meant to help individuals on their road to recovery and provide free community support.
Thank you. Captain Weatherly.
Thank you and good morning. My name is Matt Weatherly. I'm a captain for Baltimore County Police. I oversee our wellness section, which houses our behavioral assessment unit, which then houses our threat management team, mobile crisis team, peer support team, and hostage negotiation team. So when I got promoted in February of 2019, because of my background, I used to be on the formerly known critical incident support team for 10 years, which has now changed names to peer support, basically. So when I got promoted, they put me into this section, and I'm very lucky to be here because it's, my direct interest. And when Kelly asked me, I guess a couple months to be on this panel, I explained to her that, I come from the world of critical incident stress management. So, I'm more interested in, the neurotic versus psychotic as far as mental health, dealing with people who are dealing with abnormal events and trying to get them through it more so than our clinicians in, Sante, for example, who actually go out and deal with schizophrenics and bipolar and all that kind of stuff. So that's kind of my lens for how I approach some of these questions and, how I see my worldview and my role in the department. So thanks for having me.
Thank you. And Chanel.
Good morning, everyone. Kelly, thanks for the invitation. I am the owner of Urban Trauma Counseling. It's a group practice in Baltimore County, and we provide services for people who are in Baltimore County and all around Maryland, individual, group, family, couples therapy. Right now, we're online 100% because of COVID. But we hope to be offering some in-person sessions in the near future again. We're a group of 10 clinicians, and basically most of our clients come to us because they've experienced some kind of trauma not necessarily the ones that are the most common. Sometimes it's people trying to figure out how to cope with their current situations, and how they do that is to kind of go back to find out what kind of adverse childhood experiences they may have had that have caused trauma, and just how the vicarious trauma from day-to-day life, watching events happen in society via news, social media, to people who look like them or who resemble someone that is close to them, how those traumatic experiences affect them as well. I'm happy to be here, and I'm glad to be on this panel, because having a candid conversation with the community and the intersectionality with mental health, the community, and the Baltimore County Police Department will benefit all of us greatly. And that I'm hoping that people will be able to respond to crisis situations in a way that is not re-traumatizing or re-victimizing because of this educational session.
Thank you so much, Chanel. You know, your intro was a lot, and it actually takes me into my first question. So if you could tackle the first question, I'd appreciate it. And that question is, can you explain exactly what is mental health?
I look at mental health as a multi-dimensional approach. Your physical, right? Your environmental, your vocational, your social, your emotional, your spiritual, your intellectual. I think that socially, especially in the workplace, with our family, we want to feel, we want to feel connected. We need the ability to nurture relationships. And if our mental health is not well, then we're not able to do that. We may have a desire to have healthy social relationships, but if our mental health is impaired, that will also be impaired. Emotional well-being. What is our perception of our environment? Do we practice gratitude? Right? Do we live in the moment? Environmental. Are we doing something good at our workplaces and our environment that makes us feel like we're contributing well to society? Our physical well-being, our sleep hygiene. Are we eating? Are we moving? Intellectual well-being. Are we engaged in our work situations? Do we feel stimulated? Do we feel creative? And our spiritual well-being. Are we keeping our minds at peace? Do we have inner peace? Are we seeing the good in situations? So
Thank you. Captain Weatherly, what about you? What exactly is mental health?
Well, I think she covered it all. But just in general, I mean, basically echoing what she said, when I saw that first question, thinking about all aspects of your life, even though it says mental health, like Chanel was saying, it's mental, physical, spiritual, all that interacting with each other. If one's off balance, it could possibly throw off the others. Again, I look at events that affect people, critical incidents, which, overwhelm one's, coping capacities. Therefore, that would seemingly throw off, question your spirituality and throw off your physical and your mental and your sleep. So just looking at all that in a holistic system, to use a buzzword we like to hear, a well-rounded approach, a holistic system, for, like we were saying, everything that encompasses your life, and knowing that, throwing anything off balance, would tend to throw the other things off balance, trying to keep everything in check. And then when something interrupts your physical, you break an arm, you deal with that for the physical, or, when you experience your critical incident, you deal with the emotional, possibly the physical of that. Again, could bring in questions of spirituality, just to use an example, or question your marriage, or, and then knowing the resources, the person to go to that can get you the resources to affect each one of those specific entities that could possibly be thrown off kilter.
Kerry, what about you? What exactly is mental health?
I certainly don't disagree with any of the descriptions given so far, and I would piggyback and say that certainly the mind should not be treated separately from the body, and that mental health should be treated the same way that we treat any physical health. And I'll take the liberty to maybe expand on your question a little bit, Kelly, as the others have really addressed in depth what is mental health. And I'll just expand it to say what are mental health conditions, because I think it's important for us to really explain what a mental health condition is as well. And, while we all experience emotional ups and downs throughout our lives, mental health conditions really go beyond those emotional reactions. They can affect your thinking and feeling and mood. And again, it's important to know that they are conditions just like any physical illness. So diabetes, hypertension, asthma, mental health conditions are the same as any of those physical conditions. And they don't discriminate. They affect individuals of any gender, race, age, religion, and it's hard for us to define. I think it's hard for us as a society to understand mental health conditions, because even individuals with the same diagnosis may exhibit different symptoms, may have different experiences, and that makes it hard for us to define. At NAMI, we like to remind people that with early treatment and effective treatment, that recovery is possible for all individuals who are living with a mental health. That's, I think, something that will resonate throughout this conversation, I'm sure, as we dig in deeper to support services. But, I think people with a mental health condition can live effective, thriving lives.
Kerry, you mentioned some of the conditions that are associated. And you spoke of some of the normal conditions that we hear all the time, whether it's diabetes, high blood pressure. We talk about those type of conditions regularly, but it's rare that we often talk about mental health. Why is it important to talk about mental health?
1 in 5 individuals are living with a mental health condition. And that was before this pandemic. I think we are certainly seeing, that mental health conditions have been exacerbated throughout this pandemic. Why is it important to talk about? Because right now, the statistic is that only 41% of individuals who are living with a mental health condition actively seek treatment. And if you think about talking about a physical illness, so let's use cancer as an example. If I told you only 41% of individuals who have cancer go and seek treatment, that would floor you, right? I mean, why? It's a life-threatening condition. Why are you not seeking treatment? Well, a mental health condition is a life-threatening condition. Seek treatment. But stigma is still a big barrier to individuals seeking treatment. And of course, there's other issues. There are parity issues in terms of access to treatment, but stigma is a major barrier. And the consequences of stigma and the consequences of us not having normalized the conversation around seeking mental health treatment are severe. Individuals who don't seek treatment are, of course, at risk for suicide, other complications, other health complications as well, other chronic health conditions throughout life. Certainly getting early treatment, again, as I mentioned before, gets you on the road to recovery faster. And so it is greatly concerning that individuals wait so long for treatment options. And so I think, why is it important to talk about? Because as a society, we unfortunately, have really separated the brain from the body, and individuals still have this perception that mental health conditions are the fault of the individual, when that is just not the reality. There is nothing that you did to yourself. And so there should be no shame in seeking treatment and support. And in fact, as a society, we should be encouraging that. And so conversations like what we are having today are so, so critical, because we have to normalize how we talk about mental health, and normalize saying things like, I'm going to my psychiatry appointment the same way as I would say I'm going for my primary care checkup every year. It should be that for us to talk about, and unfortunately it still is not.
Yeah, I want what you just said made me think. I was at a peer group recently, and we had a guest clinician there. and one of the peers walked in and he just like blurted out in front of the whole room because he didn't care. He's like, "Hey, my clinician or my therapist is here." And it was like we laughed and he had no qualms about.
Good.
And
Yeah.
I think back, going back in my earlier days, which is, odds are that wouldn't have happened. I know him, I've known him for years, and he has that personality anyway. But just for him to do that and just relieve the whole atmosphere of the room, just because he was like, "Hey, there's my clinician. I talk to her every week," and so it was just really interesting.
Shana, do you have anything to add?
Yeah, I was everything that Kerry said, and that it's all true, and it's important to talk about mental health, just because anything that we don't talk about freely becomes anything that we talk about freely becomes normalized, understood, and accepted. It's when we don't talk about something, it's like it doesn't exist, and when something doesn't exist, it doesn't need to be addressed and cared for, and when something is not cared for, it normally suffers. That's why it's important to talk about mental health.
Do you know what different types of approaches are regarding, like Captain Weatherly said, that he has a peer-to-peer type of background? Are there different approaches between a peer-to-peer support versus clinical support when you're dealing with someone or trying to manage a traumatic stress incident?
I think so. I think there's similarities and differences. Peer supporters are actually well positioned to help in a mental health crisis for people who are experiencing a traumatic event. They are uniquely qualified because they are able to use their experience of recovery from mental health or substance abuse disorders to support others in recovery, or who find themselves struggling at the time. When peer recoverers combine their skills, often that they got from formal environments or formal training, or their experience of being in institutional environments themselves, they can put that knowledge to work, and it puts them in a unique position to offer support. Whereas clinical, it's still a necessary component of managing a traumatic event, because oftentimes a professional will offer a treatment plan based on a person's psychosocial assessed needs, meaning their need for care that takes into consideration their mental health diagnosis, substance use, their predispositions thereof, their average childhood experiences, cumulative traumatic experiences as an adult, their physical, psychological, and emotional and spiritual components. And the clinician will use all that information to develop a course of treatment that can assist the client on their path to wellness, including pharmaceutical help if it's needed.
That's right. I'll just jump in and add that, I mentioned earlier that all of our programs are non-clinical in nature, but they are designed to complement clinical service. So, when you're in our support groups or in our classes, you are going to find out from our facilitators about clinical treatment options and availability, and they are going to encourage clinical treatment because both sides are important. As mentioned, it's really the peer support is showing that hope on the other side, that there is a road to recovery, that they've been there and lived that experience, walked the walk, and that they are living well in recovery. That's so important to see when you're in a crisis situation, when it feels like it's overwhelming and when it's all too much. To see someone standing in front of you saying, "I've been there and I was in your shoes and you're going to get through this," is a very powerful message that a clinician might not be able to bring in the same way. So I think both are just incredibly important for us to promote and understand, and not silo out. The more we can bring those two things together to work hand in hand to support an individual in a well-rounded way is important. And, again, looking also not just at the individual, but the family or caregivers as well, because, the emotional toll that it can take on family members or caregivers for someone with a mental health condition shouldn't be overlooked. And so providing that peer support and to family members too, to be able to show how they've helped their loved ones and provide that non-clinical advice in how to navigate crisis situations and how to speak and communicate to their loved ones is very valuable and important.
Yeah, they're both such I'm sorry. Yeah, they're both such a specific skill set, peer support, which again, is a fairly new term, but it's perfect because, a peer is regarded by that other person who's seeking the help as somebody that's, has that instant credibility because, we use, first responders or a nurse to nurse or, an ER doctor to an ER doctor. So they already come in with that credibility. So that person is more likely to listen to whatever that peer supporter has to say because they don't have to jump those hurdles of, maybe he or she doesn't know. I was just involved in a police officer shooting, and this clinician may not be familiar with that world at all, but I bring in a peer, and we, using police officer involved shootings, we try to use our folks on the peer team that have been involved with that exact event. I've never run a scene for that. I've never been and had to pull the trigger. We've got a couple folks on our team. When we have a police officer involved shooting, we call them because they can go there and they can walk through the steps because again, they come in with that instant credibility. So that officer who did pull the trigger knows that, hey, this officer's been through this. I'm going to listen to him or her and, hopefully kind of allow them to lead them through the steps. And mitigate whatever emotional impact it's having at the moment. And then a big difference between clinicians and peers, unfortunately peers don't have confidentiality. There's I think 26 states last I heard that do have peer confidentiality. We're not one of them. So that's a big, it can't be a hurdle. Generally, 91% of folks who experience a critical incident are going to be fine. We can go there, do our peer support thing, maybe a little bit of follow up, and then statistics show that they're going to be okay. But clinicians, if we do facilitate them to a clinician, the clinicians and our chaplains both have confidentiality, and we always explain that when we're out talking to the folks that if confidentiality is really important, use our peer team to get you to a clinician or a chaplain, and then you will have, you'll be protected under confidentiality. Another big difference between peers and clinicians is peer support's more about stabilization, whereas clinical work often involves destabilizing the person before you stabilize them. Maybe dissecting the event, dissecting the emotions, where peers come in, try to stabilize you emotionally, physically, to get you through those moments and through those next few days. So that's another big difference. Also, and we always go, peer support is not psychotherapy. We're emotional and psychological first aid. We're here to put a bandage on the wound, and many times that's enough. Sometimes you might need to have surgery or get a few stitches, and then our job, once we do that first aid, is if that's not going to be enough, we have to know how to facilitate you to the next level of care, and know how to get you. And we explain to the guys and gals that all the clinicians and the therapists that we use, we know even if they're not police, they understand that culture. We have a gentleman right now who we're using under the CARES grant. I've known him for 20 years, and I know he's not a policeman. He's a psychologist, but he's been embedded in that police world for years. And when we send folks to talk to him, he's going to understand, because he's been there, understand what it's like to, through their eyes, to search a dark building and confront, a potentially violent situation. So we always assure them that even if they're not dealing with a peer, we're going to send them to a clinician that understands that world. So that's just a few of the differences.
Captain Weatherly, you were talking about officers involved in shootings, and we as a society, mental health affects us all in one way or another. And for law enforcement, they bear the badge that they are the superhero, that they can't be impenetrable as well as that strong family member, excuse me, in our families. You know, we always are wearing that I'm okay, I can handle this. How can we influence others that it's okay to seek help without feeling judged or ostracized?
I think again, changing the culture, and I think we've made leaps and bounds. I've been on the job almost 25 years of changing the culture and changing the thought processes of what peer is. Just like that example I used, with the officer who came and said, "Hey, that's my clinician. She's cool," and everything. It's cool that I go there and speak with her, and she's helped me. Bringing that out in the open. Again, changing the culture, changing the thought processes of how we look at that. Is huge. And again, having that credibility as far as peer support, knowing that when an officer comes to speak to me, we're both officers, I have that instant credibility. We can align emotionally and then hopefully get to a resolution where we can either discuss it and, I can change his or her thinking to reframe the event so we can deal with it at that point. Or if I see it's above my level of care, I realize that, which is a huge thing to realize when you need to say, okay, we've talked a couple times, I need to refer you to somebody else. And that person understanding that I'm doing that to help them, and then I'm going to be referring to them, handing them off to somebody else who I trust, and therefore hopefully they will trust as well.
Kerry, what do you think?
So one of the phrases that we like to use here at NAMI Metro Baltimore is that listening is one of the most powerful tools that you can use to support someone who is experiencing a mental health condition. And I think it's something that we all too often, a tool that we don't use. We tend to want to be solution oriented and provide feedback to individuals, but sometimes just sitting back and listening to the experiences that an individual is having, the symptoms that they're feeling, the emotions that they are feeling, and allowing them that peer outlet to hear how they are feeling is enough to encourage them to go and get treatment. It opens doors to conversations that otherwise would be closed. And so I think, as a collective, as a whole, keeping that in mind, as our loved ones are coming to us, as our colleagues are coming to us, as our peers are coming to us, as we are casually saying to each other, especially during this challenging time, how are you doing? Really listening to the answers, asking questions. And I think you eventually can bring that conversation around to, have you thought about talking to someone? Have you thought about seeking treatment? What can I do to help support you? And providing that empathy and understanding is really the way that we can influence others. And when we talk about individuals feeling judged for having a mental health condition, again, language is important. Words are important. And so making sure that we're using the correct language to encourage seeking treatment, that we're not using stigmatizing language. So not putting the blame on the individual for how they are feeling, not saying, oh, you're making too much of this, or passing over, their emotions, but really understanding how they are feeling. And if someone is sharing in honesty what their diagnosis is or their mental health condition, making sure that we're using the right language there as well. So someone is living with bipolar. They are not bipolar. The condition does not have them. They live with bipolar. Making sure that we are, again, putting that person before the illness and treating them as an individual with a mental health condition rather than a mental health condition having them. So language is important.
Thanks. Chanel?
Yeah, everything that the only thing that I would add is you could also ask people how you could do a better job of supporting their needs. Because sometimes when you put yourself in a vulnerable situation or in a vulnerable position when you're speaking to someone, asking them how could you be better in supporting them, sometimes that'll give them the courage to be vulnerable as well. You know, so everything that Kerry said, everything that's been said is right, but sometimes just modeling vulnerability and making vulnerability be a courageous thing and not something that's forbidden, right?
Yeah.
Because actually speaking, being able to speak your truth, live in your truth, own your truth is actually more courageous than anything.
Do you think that some people may feel like the word help is synonymous with the word weak as it relates to mental health?
Yeah, it depends. It depends. I mean, if you tell a person that they need help, they may feel weak, right? Just like if you ask a 2-year-old, hey, let me help you zipping your jacket, and they're like, no, I'll do it myself, you know. So it's that shame-based response that we're trying to mitigate when we're using the word help. So if you tell a person they need help, they may feel weak. However, if you ask people what you could do better to assist them, just letting them know that you notice that they're struggling in a specific area while highlighting their strengths. That may also help them to realize that you're just offering help in this area, but feel that they are good overall. Like we're just trying to mitigate and avoid shaming people when we're offering help.
I'll just add there that, you know, our volunteers that speak about their mental health conditions in a very public way on a regular basis, they are the opposite of weak. They are strong, resilient human beings who are incredibly brave. And so, what I would say about seeking help is that it is a brave move. It is a move of strength. It is not a weakness to seek help for yourself. It is it's an important time to be selfish and get that help, and that through that you'll build your strength. So, you know, I agree that with Chanel that unfortunately individuals do see help as being a weakness, and that why do I have to get help for this? I can handle it on my own. You know, and I do think that is very common, but you are volunteers that have sought that help and have come out the other side and are living in recovery. They are incredible, amazing, strong individuals for what they have been through, and now to share their experiences as well.
Yeah, I recently spoke at the new supervisor school, which are newly promoted sergeants. So, you know, they're squad commanders, they get, or squad supervisors, they, you know, can be the acting lieutenant, the acting ship commander. And I was telling them, you know, I'm comfortable with this world, you know, the soft things, you know, I'm comfortable with that. A lot of people aren't, and that's cool. You know, I said, but you know, if you have an officer, again, you know, coming from my world of critical incidents, so if you have an officer involved in a critical incident, you know, and I know a lot of you aren't comfortable with that, but you know, you got to do something. I said, you know, after you secure the scene and all that, you know, we're done with all that. And you got an officer that's bothered by whatever they've seen, or you know, whatever they had to do or whatever they witnessed. I said, you know, show up, you know, have an empathetic presence, you know, and again, all this is helping them, but you're not asking them if they need help. And I said, you know, get them out of that overstimulating environment, so get them back to the precinct, to a quiet room with their other cohort, give them some water, give them something to do. And then just ask them what they need. You know, if they tell you, well, you know, I need to call my wife and I need to talk to my kids and I need to call my neighbor to let the dog out, you help them do all that. If you ask them what they need and they can't give you anything, then that's your cue to, all right, well, I got to provide them guidance. And then I'm going to say, hey, let's do X, Y, and Z. You know, because they may be so emotionally overwhelmed cognitively, they're still, you know, they're still emotionally centered with their brain. They haven't come back to the cognitive part. So I said, simply just show up, protect them, make them safe, get them out of that environment, and then just ask them what they need. If they tell you what they need, get it for them or facilitate it to happen. I said, if they can't tell you what they need, then you know you have to step up and do it for them. You know, again, you're offering them help, but you're never saying, how can I help you? Or, you know, you're not showing that you're sympathetic or that you think like they're weak. you're simply helping them through that event without actually having to, use those words. Just, you taking the action to help them.
A couple of days ago, I attended a webinar, and one of the panelists was giving out some statistical data, and I remembered one in particular, and they reported out that 8 out of 10 employees say that they are ashamed to seek assistance when in regards to their mental health. What measures can be taken to address this type of stigma?
I would say educate. Stigma, largely at the root of stigma is just a lack of education about what mental health conditions are, how they affect individuals and families, and how recovery is possible. And so I think that largely we run a large workplace mental health campaign at NAMI Metro Baltimore, and what we train employers in is how to open those conversations with their employees, how to normalize the conversation within the workplace, how to reduce stigmatizing language. We also educate employers on what the myths are, common myths around mental health conditions, because we know that individuals with a mental health condition can be very, very effective employees in the workplace. Again, it shouldn't be treated any differently than your physical health condition. And so, if a employee with a heart disease or with diabetes can be an effective employee for you, so can an employee who is living with bipolar. So, again, reducing that stigma. And the fact of the matter is that that work is actually, is more than just a means of material support for individuals who are living with a mental health condition. It's a major way that they stay healthy and socially integrated and in recovery. And so the more as employers we can be understanding and educate ourselves and promote mental health in the workplace and make sure we're providing a mentally healthy workplace as well. So allowing individuals to take time off when they need to for therapy appointments, counseling, any kind of clinical mental health support is important. And then, I spoke just briefly about perpetuating the myths. Media and public perception continue to perpetuate a myth that individuals with a mental health condition are dangerous, they're violent, and that's just simply not true. Large-scale studies have shown there's no difference in levels of violence from the general population, and in fact, people with mental illnesses are actually more often victims of crime than they are perpetrators. And that is important for us as a society to hammer home, because the individuals who are experiencing a mental health condition are going to be scared to speak up about it. Again, if this is the myth that we're perpetuating, is that they're dangerous and that they're going to be a harm to society. Employers are going to continue to not want to bring mental health conversations into the workplace if they think that their employees are potentially dangerous if they have a mental health condition. And so we've got to break down this myth. We've got to keep using it, normalize the conversation about mental health and talk about it the same way we do physical health. If employers have, walking clubs, they should be talking about mental health within those. Tie every effort that you do together to encourage your employees to have those conversations about their mental well-being along with their physical well-being.
Thanks,
Yep.
Shani. Okay.
When you said normalize, this is exactly what I was thinking. When I get throw in my 2 cents. Our peer team now and again, for my 25 years, it's only recently, our peer team, we show up every week at in-service. We show up and talk to recruits. It becomes normal. Sometimes they're going, oh, great, there's the peer support guys. But, and they also know, like, sometimes we bring pizzas, we bring coffee, we show up at roll calls, not for any particular reason. We may be getting a comfort dog at some point, and that would certainly make it even easier to just kind of walk around and be normal. And those are the peer support guys and gals. And, they show up, they don't show up just when things are, the world's crumbling. They're a normal part, just like, our burglary unit and our detective, homicide units or whatever. They show up, they talk to us about mental health. Sometimes we just talk about whatever, but we know that they're familiar faces, it's normal, and it's now becoming ingrained into just our, like I said, our routine in-service trainings. And we have speaking at the new supervisor school, new administrator school, which are newly promoted lieutenants, just making it to where when things do go wrong, that the supervisors are quick to help. We call the peer team, and get them here. That's becoming a normal thing now to have us showing up, having us dispatch right along when things are going bad, but then also showing up when things are just your average routine day to day.
That's exactly what we encourage employers to do, is really sort of that water cooler talk. You've got to create the environment where talking about mental health standing around the water cooler is a safe place to do it, and then it's okay to talk about. And you sort of have to, as an employer, facilitate some of that normalization of this. And that sounds like exactly what you were doing, is creating those opportunities for employees to have that conversation in a safe way, and saying as an employer that it's okay to do that is just incredibly important.
Yeah, and having some advocates in the field. We now have made videos of some officers that we've had have alcohol issues, and we'll make those videos and show them in service, or so having advocates in the field, like, yeah, I called the peer support people and they were great, and this was my experience, and I'm going to talk about it.
Chanel, you have anything to add?
Oh yeah, this was good, Matthew and Kerry. I was thinking the same thing, on the lines of normalization. I mean, everybody wants to be normal. That's why people stop taking their bipolar medication and their antidepressants, because it's like, well, I want to be like everybody else who don't need it. And that's why it's very important to normalize mental health conditions. Is just the same way we normalize diabetes or whatever. It's also important to normalize the fact that distressing emotions are normal, and teach, compassion for ourselves and compassion for others. I mean, like, we are not supposed to feel good all the time. And living in a European society, we're taught that, oh, if you don't feel good, take this pill. If that pill doesn't work, we can add this one, which is all good. I mean, if that is your doctor's prescription. It's just that even when we're taking our medication, sometimes we still don't feel good, and that's okay. If you have moments throughout the day where you feel good and then you don't, that means you're alive. I mean, the sun rises, the sun sets. We have one end of the color spectrum, black, we have white. I mean, our world is built on opposites. We have high tides, we have low tides. And I think when human beings are taught that they are connected to the environment, meaning if they are highs and lows, odds and ends, backs and backwards and forwards, it's the same way with our emotions. And so I think if people felt protected in the workplace, that if they did say, listen, I'm having a bad day, I don't feel well, I'd like to take an early day, or my doctor wrote a note, I need reduced activity because I'm having too much stress. And I think if there was if there were protections in place where people didn't feel retaliated against, or didn't feel like it was going to be discussed among everybody else in such a negative and stigmatizing way, we would have healthier work environments. We would have longer standing, healthier employees who would feel comfortable about asking for help and not ashamed about not feeling well. Teaching and teaching our supervisors and our managers to practice compassion, to say, hey, I see you've been really working hard. Considering everything that you're going through, it makes sense that you don't feel well today. If you need to use your sick time, feel free. No worries. Like, just teaching that, and also having our supervisors to manage that, just to say, hey, I'm not feeling like myself today. I'm going to be in my office. I'm going to have the lights down, or I'll be off Friday to Monday. And just having those conversations and normalizing that, just like we call in to say that we have a sore throat or a cold or whatever, it's just as normal to say, I'm not feeling like myself today. I need about 4 hours. I need to leave early today. So I think that would be helpful.
Thank you. I really appreciate all of your feedback. You know, earlier Kerry was mentioning how we were as a people, how we suffered prior to the pandemic. And the year 2020, if it's not the worst, not taking away from any other traumatic incident that we've all lived through, but if it wasn't the worst, it's one of the worst years as it relates to our emotions and how we deal with things. Is there a way that we can differentiate between being emotionally overwhelmed and being in a state of depression? Chanel?
I believe it's not always easy to do, but we can do it. I mean, when you think about feeling overwhelmed, I think of what people normally say, I feel stressed, right? And sometimes stress can be good if it motivates you, but it could also be bad if it weighs you down. You can tell that you're stressed normally if the stress or the feelings of being overwhelmed goes away when the problem or situation ends, right? And it's different with depression because depression is like more serious and it's long lasting. It's longer lasting than stress. It requires a different type of help and it doesn't always go away just because there are no problems. So you may look at a person and say, why are you sad? I mean, you have everything. You have this, you have that, you have all these people around you, and you still feel stressed or overwhelmed. Then that could possibly be symptomatic of depression because it doesn't go away when the problems go away or everything seems like it's going well. Depression is highly treatable. However, it's not something that you can just snap out of by yourself. So it's important to ask for help. And when people say, just get over it or just sit here for a while in your cubicle, we won't ask you anything for the next 5 hours. It's like it's not gonna help depression. It may help stress, but it's not, I mean, gonna help depression. It's the reason, Kelly, why I say it's not easy to detect the differences is because stress and depression have like the same signs, like trouble sleeping, feeling overwhelmed, not being able to concentrate, trouble with memory, bad eating habits, feeling nervous or anxious, feeling angry, irritable, frustrated. All of these things are the same as depression. It's just about how they show up, how long they stay, and what needs to happen to help you to get some relief. Those are the differences.
Yeah, I'll just add too, anyone who hasn't been feeling anxious during this time, I would question why not. I mean, I feel like again, it's a natural response. Having some kind of anxiousness, we've all got that fight or flight syndrome. Like that's normal. That is normal to have some stress during this time, to feel some sadness during this time. We're all sort of grieving that normal that we had pre-COVID. We're all adjusting to what this pandemic has brought in lifestyle change to us now. We're all anxious about what's ahead with reopening and what that might look like. That's normal to have those feelings, but exactly what Chanel said, if that is interfering, if those feelings are becoming overwhelming to where it's interfering with your daily life, if it's causing you to not enjoy things that you previously enjoyed, if it's causing you disruption in your sleep and eating habits, if it's causing you these drastic changes in how you would typically enjoy life, and if that's lasting for 2 weeks or more, it's time to seek help. And it is hard to identify the differences because they are so slight right now, especially when we're all sort of been in this sustained situation for so long. I think there's a lot of individuals out there that are wondering, is what I'm feeling right now normal, or is this more than that? And it's time to sort of sit down and go through that checklist that Chanel ran off and say, has this been going on for longer than a couple of weeks? And it never hurts to go and talk to someone. It never does. So, I encourage you to seek support if you are feeling like this is more than what you can handle.
Yeah, Carrie, I was going to say, seek support and understand and identify healthy ways to reduce stress, right? Because a lot of us will say, oh, I'll just have a glass of wine after work, or I'll use drugs recreationally or whatever we do. Sometimes that's not always the healthiest plan. And so I think working with a peer specialist or a professional to learn healthy ways to de-stress, get the stress out, take care of your body, make sure you're eating. I just think the most important thing is not to suffer in silence and to ask for help, because the most dangerous place to be is alone in your own head.
And just bouncing off what I think Kerry said, that made me think of it. I was saying again at the supervisor school that I was just recently at. I said a good way to check on your own mental health as well as your coworkers or people in your life that either have been involved in a critical event or they're just overly stressed. A good way to measure how you're doing or how they're doing is if they can get back to their normal activities of daily living. Again, going back to an example of an officer involved in a shooting, how quickly can they recover and get back to their activities that they normally do? And I always tell them, I said, you can check that for yourself. It maybe not in the next couple of days, but in general, you're starting to take your kids back to soccer practice. You're starting to, I don't know, go to your guitar lessons, or, you might not be as effective at doing your daily activities, but you're able to get back to them and use that as a measure. And if, Karen was saying, she comes from a clinical viewpoint, I don't know exactly, but you said 2 weeks. This sounds good to me. If within 2 weeks you're not doing basically what you always did prior to the event or prior to the events that are causing you stress, then you need to, seek some guidance. Maybe start with peer support, but you're probably going to have to be facilitated to something a little bit higher.
We were sitting here talking as you all were speaking, and we use the word normalization a lot. We want to normalize our mental health. And the word desensitization popped into my head. If we are normalizing our mental health, is that any way equivalent to being desensitized with life? How does desensitization affect how we process a traumatic event, let's say? Or you know what, even if it's not desensitization, is it a coping mechanism to just turn off so that we don't have to feel, we don't have to go through that emotional roller coaster?
Yeah, Kelly, when you said, how do we process a traumatic event when we've been desensitized? As soon as you said that, I thought we don't. Whenever we've experienced desensitization, it doesn't allow us the ability to process trauma, is the short answer, right? If we become desensitized, we may ignore stress, we may ignore fear, we may ignore sadness, not intentionally, but it's just not floating up to the top as something that's needing to be addressed. We ignore all the feelings and emotions that the trauma is causing. Some of it is fight, flight, or freeze, because we become frozen, right? People disassociate, meaning they check out so that they don't feel. Some of that is life-saving when it's done in a temporary situation. It's healthy for all of us to temporarily disassociate. It's life-saving, right? Because if I see a kid who's about to be hit by a car and I think too much about that, it's going to stop me from jumping in and grabbing the kid. So I may disassociate, or I may check out, or I may not be thinking or feeling all of the fear. And then after the fact, I might say, wow, that was scary. That's appropriate for me to process it later. It's when we don't process it later that it becomes post-traumatic stress disorder, right? And so some people, they ignore sadness, anger, fear that's caused by the traumatic event, and they chalk those feelings up to just being okay. And you'll ask them, how are you feeling? And they'll say, I'm okay. And what we need to get back to is that it's okay to say, I don't know right now, or just to give ourselves a moment not to be okay. Work towards making that more acceptable. So if you ask someone, how are you feeling about, whatever is going on? And they say, I'm fine. We could always model and say, it's okay if you're not okay. Like it's okay if you're not okay. I can sit with you. I can be with you. Or I can get you to someone who can sit with you, just to make sure that you are really okay.
Sort of feeling that we've got to be, strong for those around us and not exhibit those emotions and be the hero in the situation. And, I took care of it and everything is handled. And in reality, again, just what Chanel said, that doesn't allow for time for healing. And it's so important to take that time for healing. If we're not, we're not increasing our resilience through avoidance. That's not how it works. We're literally just avoiding that healing process and postponing recovery, really, is what's taking place then. So, I think that it's probably easy to confuse desensitizing with being resilient. And that's really, they're actually very opposite. It's really avoidance versus working towards a recovery process.
I actually, when I saw the word desensitized, I looked at it more as like, as we were talking about earlier, like stress inoculation, giving folks pre-education about what they could experience, normalizing emotions and physical reactions they could experience when they have a traumatic event. So when it does happen, they've been forewarned, therefore they're forearmed, so they understand. Oh, okay. Well, they taught us this last year at in service. That's why I'm having a little trouble sleeping, or I'm having a couple bad dreams. So you're kind of putting a little desensitization in there, so when the event happens, they're not so sensitized, for maybe lack of a better word, that they can bring themselves back and look at it more cognitively and understand, okay, this is what's going on. I kind of, when I saw that, I looked at the extreme example of like someone who's completely desensitized, like a sociopath or a psychopath. They're never traumatized, no matter what happens to them. So they're perfectly suited for critical events because they're never traumatized. So, bringing it back from such an extreme example, how can we teach our folks to desensitize them a little bit with education and normalization, that when this does happen, when the event does happen, that they'll understand and maybe be able to temper their sensitization to it. And, when it does happen, let's say, they do witness something that is bothering them, they'll look at crisis as a toxin. So how can we give them the antidote to that toxin? We are an empathetic presence for them. We give them, if there's chaos, you give them structure. If they're having trouble thinking, you slow things down for them. Like I said earlier, maybe help make decisions for them, or give them guidance. They were involved in an event that gave them, they felt a loss of control. Bring them out of that stimulating situation and give them a sense of control. Give them a bottle of water to drink. Give them the telephone so they can make phone calls. Try to be the antidote to all those things that perpetuate the oversensitization to the event. Because, if you look at PTSD from a 30,000-foot view, it's overstimulation and it's a violation of their worldview. So at least we can lower their stimulation chemically, because it can change your brain. Get that tamped down as quickly as possible, and then you can reframe it as you meet with them later after the event too. If they see this as something that's shaking their worldview, try to reframe that through cognitive behavioral therapy or something like that, to where you're specifically targeting what their thoughts are, changing their thoughts to hopefully change the outcome. So I kind of looked at desensitization like that, trying to lessen the sensitization for what might happen for when it does. And then if it does, let's lower that, try to desensitize them a little bit to get them through the event.
Matthew, I like that. And, when you think about first aid and bringing down emotions right at the beginning, that's all that is very important. I also think about complicated PTSD. And so sometimes when we may run into people who you feel like you get them tampered down and they go right back up. It's like you fizzing down and it goes right back up. That's another thing that we have to recognize, is that when we see people doing that, you're doing everything, you're trying to get them back down. A lot of times they're not responding to the traumatic event that just happened. They could possibly responding to a prior traumatic event. And in that situation, if you see that it's not working or they keep going back to it, even after you've done everything, that's when I think they need to be referred into therapy so that they can deal with that underlying trauma. Because we'll even have people in workplaces who, I don't know, miss a deadline or have one write-up and they explode. And you think it's really not that serious. I told you this was just a corrective action, or this is a warning, but for them, it's much more than that. And that's how you can tell if someone's responding to a situation that's not present. That could be a past traumatic event. And that's where therapy comes in, where they need to go and get to the heart of it, the root of it, so that their reactions won't be over exaggerated. So that they can become less hyper vigilant once they realize that whatever happened to them is no longer happening, and they learn the skills to separate past events from present events.
Perfectly stated.
If, let's say, a viewer is watching this recording and they want to assist, they just know that they're not a qualified person. Would further damage be done to if a non-qualified person were trying to address someone experiencing a mental health crisis?
I don't think they.
Oh, go ahead, Shana. Go ahead.
No, go ahead, Kerry. Go ahead.
I think that you could go either way with this question, Kelly, honestly. I think that, again, I bounce back to sort of that listening is the most powerful tool you can use. If you aren't trained in how to de-escalate a mental health crisis, if you aren't trained in mental health resources and how mental health first aid, for example, I think the most powerful thing that you can do in that situation, if you're with someone who is experiencing a mental health condition, is just listen to them and call for support, just like you would if someone is having a heart attack. You're going to call for support, right? Because you may not be trained in CPR, you may not be trained in how to assist that individual at the time, so you're going to call, right, for medical support. So no, I think yes and no. I think, Kelly, that if someone is wanting to talk about their mental health with you, you should listen. That's important. Say, I don't have training for this conversation, I'm walking away. That would not be the appropriate response there. You should listen, and you're not going to do more damage by listening to someone. Absolutely not. Where you will do more damage is by not listening to someone, by shrugging off what they are talking about by saying, "Oh, just shake it off, get over it, get on with your life. Why don't you go get some more sleep or something? You're just grumpy today. You're having a day." All of those things that we've all been guilty of saying, right? Those things can do damage, and so. I think that when we talk about, is someone not being trained responding, can it do damage? Yes. I mean, we know that for youth, age 10 to 24, if they're experiencing a mental health condition, they're at a higher risk for suicide. So if you aren't listening to them, if you are not recognizing the signs and symptoms, if you are being an individual that just shrugs off what their experiences are, and you're saying like, oh, you're just acting like a teenager, yeah, you're risking causing more damage, and that damage can be extreme. It could be suicide. So, you know, I think it's important for us to recognize that these are, again, illnesses. And it's not to be just overlooked and passed over. You know, we do have to be careful with our words and careful with our response. But that's not to say that the lay individual can't be supportive to someone who's in a mental health crisis. You absolutely can be. And if the best thing you can do is listen to them.
Yeah, exactly right. Kerry, I was thinking the same thing. I was thinking on the lines of, you know, people acting outside of their expertise, even clinicians. Like, I'm not just talking about lay people. I'm talking about trained, licensed therapists. If it's outside of your wheelhouse, the best thing to do is listen, express empathy and compassion, because if not, you may re-victimize someone by shaming, putting yourself here, putting them there, or I wouldn't have done that, or I would have done this, or you should have, you know, sometimes advice is not needed. That's why that listening is good, especially if advice is not solicited. I just think that when I think of re-traumatization or re-victimization, I think it's when a person's current situation is colored or triggered in some way by a person's tone, the way that they're handling the person or the people around them or the situation. Words like you said, get over it, you know, you should have done better. It's like we have to ask ourselves, why am I doing this? Why am I talking? You know, sometimes am I helping the person, or am I helping myself to feel better about what's happening right now? And if you can always tell if you're at risk for re-traumatizing someone if you have an agenda. So if your agenda is to have this stop right now, to have them get over it right now, to have them stop crying right now, if you feel yourself having an agenda, you might not want to talk until you're full on with self energy that's filled with just compassion, understanding, and getting them to the next place, whether that be another peer person or another professional that can assist them further.
Yeah, that's a good point, Chanel. You know, naively, I always think people have the best intentions. So, you know, as you were saying that, I'm like, oh my gosh, you know, I never even think, you know, folks like, you know, and that what we do might have other agendas. So, I mean, that's a very good point. And I was thinking, you know, like I said earlier, when I go to the supervisor school, you know, at least do no harm. You know, you can't harm anybody by listening to them, as both of you were saying. You know, again, you know, if it's an event, make the person comfortable, get them the support they need, maybe some other coworkers that you know they're friends with, get their family there, you know, listen to them, ask them what they need. Again, just if you can just do nothing but do no harm and just try to protect them as best you can, because, you know, you can't fix it. You know, if you don't know what to say, just kind of ask them what they need and leave it at that. You know, at least at the most, don't, you know, try to mitigate the situation, don't make it worse. So, and I try to tell people, like I was saying earlier, people that aren't in this world, at least, you know, just do those couple of things, you know, stabilize them. You know, just like if I was confronted with somebody displaying a mental illness, you know, if I was in a grocery store or something, you know, I don't really know exactly what to do or what they're diagnosed with or their medications. And even if I asked them, I probably wouldn't understand exactly, but at least I could stabilize them, listen to them. And, you know, while I'm getting somebody to say, hey, call the therapist or call their family, you know, at least I can just sit there and listen to them and, you know, try at least not to exacerbate the problem. And understand that it's beyond me, but I'm the person there right now. I've got to do something. But understanding, like, when I get somebody there's a higher level than me, then I pull back and let them take over.
You know, Matthew, when you just said stabilized, it made me think of self-care. What does self-care look like for you?
For me, it's doing the things that I want and need to do daily to, continue my life going forward, I guess. Um, and knowing that if something's a little bit off, I play guitar a lot. Um, and, my wife would certainly notice, well, you haven't been playing much lately, or, what's going on there? I'm not a great sleeper, so that's really no good indicator as to if I'm stressed or not. But, if I'm going to the gym, which I love to do, if I'm playing my guitar, I'm doing the things that are routine for me. The people that are in my world looking at me can certainly see that, I'm taking care of myself. If they see that those things are starting to falter, then they would intervene and say, hey, you're sleeping more than you normally do. Or, you're not playing your guitar, you're not going to, there must be something going on.
Yeah.
So.
Chanel, what about you? What does self-care look like for you? Okay, till we get Chanel back, what does self-care look like for you?
No, I think that especially in this pandemic, self-care for me has changed dramatically. Um, with the rest of my life sort of an upheaval of transitioning to working from home, the mental health needs of the community being in high demand, and then, having a 5-year-old who requires a lot of time and energy. The best thing that I have done for myself through this pandemic is commit to physical exercise, honestly. And it is something that I am selfish about every single day. It's something that I wasn't selfish about before the pandemic. So it's been a dramatic change for me. But it's something that I realized that I needed, and that if I didn't selfishly take that time, even if it's half an hour, but take that time for myself every single day, that I wasn't going to be giving the best that I could to my job, to my child, to my family, to my friends. So that's been really just critical to me, especially now.
Yeah. So I have one last question, actually. Hopefully Chanel will come back in. I know she was having a computer issue, but until she returns, oh, there she is. Wonderful.
Yay.
Chanel, what does self-care look like for you?
So many things. And I think as a clinician, I'll just start here. Self-care looks like me learning how to have more compassion than empathy. We were taught differently at first. We were taught to be more empathetic. But what that means in just layman terms is learning how to have compassion for a person instead of feeling all of what they're bringing in that moment, in that crisis moment. The truth is, even for peer specialists, supervisors, when we are busy trying to feel someone's whole extent of their pain, of their trauma, we don't have enough on board to help them. So I think self-care looks like learning how to have compassion for their pain and not trying to feel their pain or, be in their pain. It's just having compassion for their pain and seeing how you could be beneficial to them in that moment. Also knowing when you're not well. Self-care is being able to say, not today, can't do this today, tag your it to someone else and being okay with that.
So before you click back in, I said that I had one last question. And Chanel, you can be up first since you just ended.
Okay.
How would you support your loved one's decision to become a member of the law enforcement community?
Oh, I would definitely be a proponent of them doing their own work, meaning having them or trying to encourage them to go through a process of learning what their own triggers are, emotional triggers are, learning their biases. So we all have them. Most of them are unconscious, so working with a professional on that. Learning what they're afraid of and being okay with that. Right? You don't want that to sneak up on you. And working through their own maladaptive behavioral responses or their unhealthy behavioral responses in difficult situations. And the reason I'd encourage and I know that this is what police training, from what I hear, this is what they do. I would encourage people to take it very seriously, this process, because I wouldn't want my loved one to be caught off guard and harm someone else or be harmed because they haven't done this work.
Thank you. Kerry? Can't hear you.
There we go. I couldn't have said it any better, honestly. I think that, you know, there's some work that we can all do as individuals to make sure that we are mentally healthy and taking care of ourselves. And I agree with Chanel, everyone's got biases, so making sure that we're using all of our tools and resources at our disposal to educate ourselves as we can, and going into such a challenging profession, already have taken on some of that work maybe on your own as well, making sure that your resiliency tools are in your tool belt, that you know are mentally prepared for such a challenging profession, and to handle the demands that will come with that as well. That's exactly.
Yeah, and Carrie, I would even go as far as to say, I think before in my program, before I could become a therapist, I had to do a year of psychotherapy. They didn't tell me what to work on in psychotherapy, and I had to give receipts. Like, I went to therapy, this is my receipt. Not what we talked about, but just I went to therapy. And I'm wondering if officers already have that requirement, not telling them what to talk about, but just the fact that you go and do some work on yourself with a trained professional. Not to disqualify you or anything like that, it's confidential, but just to make sure that you have that opportunity.
Thanks. Matt, how would
Yeah,
you support?
when I saw this question, I was thinking of a younger generation that would be entering into this field. So that's kind of how I looked at it. I would certainly explain my experience to him or her, which has been great up to and including today. Tomorrow might be different. But I always tell people, 90% of the time I was at work, I was having a great time. But then, if this person was younger than me, get them, someone on the job that's of that same age, that same generation, have them explain, because, I'm sure the folks coming out of the academy now see the job completely different than I did. I kind of caught the tail end of body cameras. I was never really affected by that, and everything's on the computer. I mean, I couldn't even write a report in the field anymore. So I don't understand their world at all, like the standard patrol folks. Which, again, when I saw this question, I was thinking about somebody going into the academy and then coming out, going on the road. So I would tell them of my experience, but then hook them up with somebody who has been there and done that recently and kind of is in their same age group, to where they kind of share the same worldviews. And again, normalize peer support if you need it, and therapy if you need it, and educate them on what to potentially experience, and that there's help for the things that you experience that aren't so great, because you're going to experience things that aren't so great. But conversely, you hopefully will have a great career and a great time. And I know right now there's a lot of stress with the political climate, and all that kind of stuff. That kind of stuff I think comes and goes. Talking to a 20-year-old about how it was in the 60s and the 80s may not resonate, but we've all seen the ebbs and flows of how law enforcement is perceived, and at least in Baltimore County, they like the police for the most part. I think you know, that was certainly proven to me when we lost Amy Caprio a few years ago, because I was the commander of Parkville, and just the overwhelming support was just every day when I went to work was just unbelievable. People out there do like us. So I would reiterate that to them, and if they're feeling stressed because of the current environment, that, you know, I think that's going to come around, where we'll be, you know, looked upon in a better light. There's always going to be events that make us look bad, but that's in every, you know, occupation. So just try to give them my viewpoint and hook them up with somebody who is in their age group and kind of explain things in modern terms. So.
Thank you so much. This is actually the end of our candid conversation session. I will ask each of you if you have a closing remark you'd like to share. Chanel?
Yeah, I just want to thank Kelly and Matthew and Kerry for such an inspirational, educational, and informational, candid conversation. You guys have taught me a lot, and I'm hoping that this would be a great hope to those who view it later.
Thank you. Kerry?
Just want to thank you all. I always learn something from my fellow panelists as well. And so, you know, this was a great conversation today. I certainly learned a lot. And I hope for those listening that they are encouraged to seek support if they, you know, are looking for support for a loved one or for themselves, that they, you know, turn to NAMI or turn to other resources and start to seek that support, because this conversation encouraged us all to take care of our mental health a little bit more.
Thank you. Matthew?
Yeah, I want to thank all of you individually, and Kelly, thanks for inviting me. Again, kind of echoing what was said prior to me, you all have made me, you know, sparked a few things in me that hey, I never thought about that, or you know, and that's important. You know, we're all here, and we come here with a different viewpoint, and to get others to spark something in them that they had never thought about, that hopefully they can carry forward and add to their toolbox, is certainly important. I think, you know, luckily we're living in a time now that I think we're seeing a culture shift, at least in the law enforcement world, and I guess the first responder world, to one, have an understanding of folks with mental health issues. You know, when I worked patrol, you came across somebody with a mental health issue, you locked them up. You know, that's just what we did. Sometimes we eval'd them, but, you know, unfortunately, we just really didn't know. I mean, you had somebody shoplifting and you knew that they, you know, it was a mental health issue, but we didn't know that. You know, we just locked them up. And that's all changing now. You know, I have the mobile crisis team. I hear them called constantly, and they're getting called to things where they can mitigate a situation where, again, in my day, we would have just made an arrest, or, you know, we just didn't know about resources. And, you know, mental health just wasn't a thing like it is now. So that's certainly a culture shift, and then the culture shift within this world of being able to reach out for support, and it's normal. And so, you know, I think those are the two key things that we see really changing currently that are for the positive, you know, for the benefit of all of us.
You know, I appreciate each one of you so very much for taking time out of your day for this discussion and recognition of Mental Health Awareness Month. May you be happy, well, and safe. Thank you very much.
Thank you. Bye.